Alright guys, so here is an X-ray AP lateral of this patient's left knee, and I note that this is skeletally immature, right? I can see the open physis at the femur and the open physis at the tibia, both on the AP as well as the lateral view. Now this is a patella, right? So the most obvious finding that I can see here is a fracture of the tibial tuberosity. Right, there appears to have some comminution, and it is extending into the intra-articular aspect of the proximal tibia. So that was the X-ray given at box number 4. The first step, I want to stabilize the patient with ATRS principles. In terms of the history, I want to know about the mechanism of injury. All right, and thereafter, looking for any ample history if necessary. In the examination, very crucially, I'm looking for any open wounds. Number 2, looking for the neurovascular status by checking the dorsalis pedis as well as the posterior tibial pulse. I will also assess for any compartment syndrome because the anterior tibial artery is just in this proximity, and injury to that can lead to compartment syndrome, a very real complication in an injury over at this area. And a secondary survey to look for any pain at the hip proximally as well as the ankle distally. Now, the next step is for acute management, box number 5. I will start the patient off with analgesia. Thereafter, the patient will require temporary back slap, right, for stabilization. And this will be a above knee back slap. Reduction in this case is not very possible, all right, in view of the small fragment. So the knee should be back slap in extension. As you can see here, there's a shadow of a back slap already in place. Now, the next question for the clinician is to ask ourselves whether we need advanced imaging. Now, in this case, this is a proximal tibial fracture with intra-articular extension. A CT scan is ordered to look for the intra-articular fragmentation and to plan for the surgery. So here is my explanation and walkthrough of the CT scan.
Alright, so this is a CT scan of this patient with a tibial tuberosity fracture. The most helpful view here, of course, would be the sagittal view. So as I'm scrolling through the sagittal, first of all, we can orientate ourselves to know where is lateral and where is medial. So over here, there is no fibula on this side. So this, I'm going to scroll through the medial side first. And here we can start to see the fracture of the tibial tuberosity. There's an intra-articular extension of it. All right, and the tibial tuberosity is avulsed off with the patella tendon. Now, firstly, appreciate that this is a CT scan, and therefore you do not see much of the patella tendon or the quadriceps tendon. You can see the bony structures really well. Okay, and as we zoom in a little bit more, there you have it. And here we have the fibula. We are scrolling towards the lateral side. So this is a displaced intra-articular fracture of the tibial tuberosity. There's also going across the physis, right? The physis of the femur is seen here. The physis of the tibia is seen here. Okay.
All right, so that was box number 6. The next question to ask ourselves is what's the definitive management for this patient? This is a young patient, right? There's a completely displaced tibial tuberosity fracture. It is displaced very far, so if it is not reduced and fixed, the patient will forever have either an extension lag on it, not able to even extend the knee because there's a disconnect between the patella tendon and the tibia. So in this case, surgery is indicated. All right. Here, what has been done is open reduction, internal fixation. You can see that, and the device is used to reduce the tibial tuberosity. Remember, the forces acting on it is the patella tendon is very strong, so it requires lots of force to push it in. Next, you can see 3 cannulated, partially threaded screws has been used to fix the fracture in place. Note that the physis is an attempt not to cross the physis in any of these screws because we want to prevent any disruption to the physis. All right, so you have one screw going through the epiphysis and two through the metaphysis. There is a physis of the tibial tuberosity that is unfortunately have to be bypassed to fix the fracture, and hopefully this does not lead to long-term recurvatum of this injury. All right, so this is a lateral view. This is the AP view. These are images taken with an image intensifier intraoperatively. Okay, now after the surgery, the patient will have a repeat x-ray done, and you can see it's a repeat x-ray. Before and after, you can see the fracture is well reduced with 3 cannulated screws with washers. Okay, after surgery, in the post-op review, we assess the patient vitals, and then we assess the wounds. All right, there should not be any drains in this case. Prophylactic antibiotics will have been ordered after the surgery. In this case, the patient may be allowed some kind of partial weight bearing for the initial few weeks. Now, what is a potential long-term complication of this injury? Number one, there is always risk of non-union. Because this is very near the growth plate, the physis, there is a risk of growth arrest in any of these physis. What we can be wary to follow up with would be look for recurvatum. Recurvatum means I want you to imagine that if, as we can see, most of the injury occurred anteriorly, isn't it? So therefore, the posterior physis should be expected to be normal, and this will continue growing, right, as the child grows. However, if there's a part here that is injured, right, what happens is that there will be very little growth in this aspect. So what will happen? The posterior of the tibia will grow more than the anterior, and what will happen? This is what will happen. There will be what we call a recurvatum deformity. All right, I'm obviously drawing it in a very exaggerated manner. All right, because there is more growth posteriorly than anteriorly, and so therefore, all right, there will be a kind of hyperextension kind of appearance of this knee should there be growth arrest in the anterior physis. So we have walked through a case of a tibial tuberosity fracture in a young patient, and I hope you can see how the trauma framework can safely bring you through this case with confidence. Take care.